You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Hi, everybody. We're back at Stellar Success Podcast with your host, Dr. Tudor Francu. I have a great guest today, Dr. Douglas Brown from Alabama, with an interesting story and an interesting passion. How are you, Dr. Brown?
Good. Great. Nice to be here.
Dr. Brown, we're on Stellar Success Podcast, and I want to start by asking you, what do you think success means to you in your professional and your personal life?
What would success mean to me? In my professional life, having the skills to help as many patients as I possibly can and doing it well. That to me is success in my professional life. In my personal life, success is happy wife, happy children, and everybody contributing to this world in a better way, to make it better than what it was when we got here. So far, so good.
That's awesome. So give us a little bit of overview of what your story is. How did you start, your journey along the way, and where are you now?
Well, years ago when I was at 6 years old, I knew I was going to be a doctor. I had decided then. And so the rest of my life was basically headed toward that goal. There was some, I veered here and there, of course, as anybody would, teenagers and so forth, you're going to do things. And I did. And did my undergraduate. And in my before I went to graduate school, this was in the 80s, and Roe v. Wade was pretty popular then. And so I was one of the guys that was like, there's no way I would consider doing abortions. I wouldn't do it. There's other doctors that, of course they would, but I'm not. I wouldn't. My conscience wouldn't allow me. So at that time, if you said that, you didn't get involved. You didn't get invited to medical school. I mean, it was crazy. Now it's just the opposite, right? Back then it was like that. So I asked one of my colleagues, a physician who was a friend of mine, I said, what am I going to do? Because I know they're going to ask the question. I'm going to tell them no. He says, well, what about chiropractic? Have you ever thought about that? I go, no, I don't know anything about it. He says, look into it. And he says, also, they kind of think like you, so you might want to look into it. He says, two good things about it. You can help a lot of people and you won't kill anybody. And I'm like, well, that sounds good. So I did look into it and I did like it. So I did that first. So I went to chiropractic school. It was great, great education. Learn about holistic health, learn how to tie all the pieces together to help someone regain health rather than just treating the diseases. It was great. It was really great. Practiced for about 7 years and I was getting bored, getting anxious and irritable. So I go back to school. This time it was a fellowship in chiropractic neurology, which is a 2.5-year fellowship. Then medical neurology, which is your typical, neurology. And that was 3 years. I did that with Dr. Lauren Miller. I was a fellow with him and did all the other stuff, grand rounds, the stuff that you do. So I did all that. And along the way, I'm really, really, really intrigued with the brain. That was what excited me. And before I even did a fellowship in neurology, I asked those guys, I said, is there an effective treatment for the brain? I mean, can we really make a difference? Because I don't want to go into neurology and just diagnose somebody and not help them, So they were saying to me at the time, oh, yes, absolutely. We're doing things that you won't believe now. So get into it, start learn how to do some crazy things like awaken coma patients and things like that. It was just using various different new techniques and technologies. And that was really exciting. And so that's why since that time, I've been going straight just the brain, treating it. We've got technology that we use. We've got, information that we know that we didn't know then, such as stem cells in the brain. We didn't know they existed back then, but we now know they do, and we can activate those things to really make a difference. So I started looking more into dementia patients. Forever we thought there was nothing you can do. So I started trying some of these techniques out, some nutrition, things like that. And I was starting to get some results with these patients. And I'm like, wow, I need to know. There's a lot I don't know here. So I go back to school again. This time it was functional medicine. Got certified in functional medicine. learn how to take care of patients from that perspective. So now I'm combining all these disciplines to be able to treat patients with brain disorders in a holistic way, to hopefully make a lasting impact on their lives going forward. And so that's basically the story. And here I am today. Me and my wife work together, and we've been doing that for several years, and it's going really well. We're really happy.
That's very interesting. I think your specialty and I would say subspecialty, treating the brain disorders, is something that it's not only hard, but not too many people are proficient in doing that. And I think we only know a very, very small percentage of what's going on in our brain. But what are some of the things that you think are very important in what you're doing and could revolutionize, I would say, the medical field in your specialty?
Yeah. One of the things, functional medicine. That's one of the very important. What are we doing in that? In functional medicine, we look at every parameter that could be off. For example, hormones. We look at the hormones, right? Reproductive hormones, thyroid hormones, insulin, its effect on all of those and their effect on it. We look at vitamin deficiencies, parasites, all these things we look at the same time in order to get the best results. Functional medicine is a huge part of that. Lifestyle. So functional medicine includes that. Do you exercise? How well are you sleeping? What are you eating? What are you drinking? And where does it come from? Where do you live? Your air can affect you, all these things contribute to that. And that's a big deal. So to say it's one thing or two things, it would be totally wrong, because we've got to look at the whole world of a person, where they live, how they live, even who they live with. Is it a good relationship or is it a bad relationship? All these things contribute to a person's health. There's just no simple answer. I'm sorry. I wish I could just say, this is what you need to do it. Just doesn't exist.
No, I think you touched on a very important subject in medicine, the fact that, a lot of specialties, we have a lot of specialties in medicine, and everybody is their own niche of treating something. And they don't look at anything else other than that organ or that symptom or, that disease, which, like you said, functional medicine treats the body as a whole. And it's very important to look at the whole system to improve one specific thing.
Right. You can't treat a brain unless you look at all of the systems of the body. Then you can treat the brain, So when we look at the brain, we look at it in like multiple pathways that are within the brain, right? They're all communicating with each other at the same time, all the time. But some of them don't do exactly what they're supposed to do. And I like to tell the patients that that's a bridge is down. We got to rebuild it, For example, maybe a person has a problem with their right cerebellum and they're a little bit off, maybe miss a pass, past pointing finger, nose, or balance is a little bit off, things like that. Or vestibular system, maybe it's not integrated exactly right. Well, that can affect the left frontal lobe. That could be the problem. I know it sounds nuts, but things like that, looking at these integrative properties of the brain, that's how we treat it, right? We look at the brain in such a way like, okay, what area is the weakest? And how can we affect change in that area the best? It might be standing on one foot. It might be taking this medication, It might be spinning, or it might be eye movement exercises, And when it comes to depression and dementia and things like that, I like to use deep transcranial magnetic stimulation so I can directly affect the brain, the changes in the brain,
This is amazing. Can you tell me a little bit more about this method? Because I think one of the things that are on the front of medical treatments right now is how we look at dementia as a disease. And a lot of people say, it's type 3 diabetes, it's due to glucose and insulin intolerance and all this stuff. But there's no clear path to treat the disease.
Yeah, that's what I'm saying. That's why we have to, what you just talked about, the type 3 diabetes, yeah, we talk about that, but that's only one aspect of it. You hear people talking all the time about beta amyloid, right? Tau tangles and all these things. There's people that die like they played bridge yesterday, right? And there's nothing wrong with their brain, but it's full of these tangles and beta amyloid, but they had no disease, right? So we know that beta amyloid occurs in a lot of different conditions. You can get a broken bone and you'll increase your beta amyloid. Your taus and tangles, those are just structural lattices of the cells. You know that, and probably most of your audience knows that too. These things are not causing the disease. These things are a result of the underlying disease. It's sort of like you go to a battlefield, right? And you see all these dead bodies, and you see all these spent shell casings, from the bullets. Oh, well, the cause of this death of all these bodies must have been these shell casings, right? It's just not good thinking, and that's what's happening with this disease. Is they're targeting the wrong thing. It is not beta amyloid. Beta amyloid is a result of the inflammatory process that happens in the brain, but it happens in everybody's brain, and it can happen to a great extent without any symptoms too. So that's why we don't target the beta amyloid. And we look at it, we look at tau, of course, if there's a lot of beta amyloid in there and a lot of tau and those levels are high, yeah, we're going to think about that. What are we going to think about though? Inflammation and what's causing it, not targeting the beta amyloid because it's there, it's a thinking that we as physicians got from, biological disease, right? You got a bacteria, it's all over the place, it's eating the patient up. It's the problem, right? Well, that doesn't translate with brain disorders. It just does not. You have some autoimmune diseases, yeah, those are clear cut, MS. But even that, we are not looking at the underlying cause. And if we do treat the underlying cause, that MS patient, you can stabilize too. That's what I'm getting at. You can't look at one thing and one thing only and think, oh, that's it. Because look at the failures of targeting beta amyloid. It hasn't succeeded yet. And now we're talking.
How is this new treatment helping dementia patients?
Okay, let's get to that. Treating the underlying cause will allow the patient, their body, to re-establish normalcy again, right? Homeostasis. And when we do that, that will give metabolically the brain a chance to thrive. Now it has a chance. We've reduced the inflammation by treating the patient functional medicine-wise, and now we've got a brain that can actually thrive under the right conditions. Now, there's the key. We've got to create the right conditions. Now, we use DTMS. Basically, what it does is it stimulates the brain with a magnetic pulse. So we got a 1.2 Tesla magnet, just like an MRI, but it's a lot smaller, condensed into a helmet. You might have read about it. It stimulates the brain in targeted areas. And it still, with it being deep TMS, it doesn't just affect the targeted area. You can't do that with the brain. You can't just affect one area and not affect the whole brain, right? So because the brain is an electrical circuit, just like a computer, if you introduce a magnetic pulse to that electrical circuit, you will affect change. You will make the brain do something. High frequency causes the brain to form new connections. Low frequency causes the brain to form less connections and slow it down. So that's what we basically use with patients with dementia. We use high frequency with low dosage to get their brain to start creating new connections and increase blood flow to that brain and increase oxygenation to that brain all at the same time. Then, once we do that treatment, which takes about 20 minutes, then we take that patient, and we've also given them oxygen while on TMS, because TMS has opened the blood flow up. We give them oxygen, they're breathing it. Now we've oxygenated really well the tissues. We take that patient, and then we work on dexterity. We work on balance exercises. Then I've designed specific speed of thought exercises that we work on, like identification, naming things quickly under a metronome. And so all of these things are done each visit that the patient comes in. That's what we do to stimulate that brain to start recovering, to start coming back rather than declining. And that's how we get these results we get. It works. It works. Everywhere you go, just about every state in the nation has people that are treating patients with dementia now successfully.
That's amazing.
It is amazing.
Yeah, it is amazing. And I think a lot of research should go into this type of alternative treatments
We're researching
rather than rather than look at the one single medicine and the magic pill that doesn't exist.
Yeah, it will never exist with brain disorders, period. It won't.
Yeah.
Because the brain depends on all these systems, all of them, to survive.
Yeah, absolutely. And I think it's the organ that we know the least about.
It is.
And we're trying to kind of reverse engineer the creation of it. And I don't think we got to even scratch the surface on it.
Not even.
But
are you a busy medical professional striving to excel in life and work?
Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now. Yeah, people like you and, with successful results in this area, I think they're very important. And I want to go back to your mindset, I would say, because you're somebody who went back to school a few times and you kind of strive to better yourself in your education. What do you think it's a step back, that something that didn't work out in your life and your professional career that kind of pushed you forward a little more?
Well, for me, my dad gave me advice one time that was actually good. He said, Doug, you don't have to be the absolute very best in your field, but you better doggone well be among them. And that was good advice. So I took that advice. And so when something comes up in my field that I don't know, I'm going to find out. And when I realized that this new medicine, this new field of functional medicine had it right, it was time for me to learn it. Same thing with neurology. It's one thing to just localize, diagnose, and say, well, that's what it is. That's one thing. But what are you going to do about it? How are you going to fix this? We can drug it and dumb it down, but that's not fixing anything. It's just making a change that you like,
Do you consider yourself someone who has special skills or habits to get to the point where you are right now?
Yeah.
What are those?
Without being arrogant, if I don't know what I need, what I believe I need to know, I'm not going to stop till I find out the answers. That's basically who I am. I'm going to get the answers one way or another. Somebody out there has some research that's going to lead me in the right direction to figure out what I need to know. And I'm just tenacious. I think that's one way I can describe myself. I've always been tenacious. I don't give up.
Yeah, absolutely. I think this is one of the important things of someone who can get results, just keep persisting in their field. Now, talking a little bit about the fact that, you went back to school, you studied more, you educated more in one specific field, and you kind of find your niche where you're successful right now. There's a lot of talk in the medical community right now of people that are either burned out or not be able to retire, and they have a passion, they have a medical practice passion, but financially they're strapped.
Mm-hmm.
How do you see this thing evolving for yourself? Do you have any strategies to get to a point that you can easily retire if you want, or not practice? Any kind of specific strategies that you use
right now? I don't want to quit. I don't even want to think about that. I don't want to retire, because it's important. I love it. My wife loves it. We love our patients. I can't ever see me retiring, honestly. I'm 57 years old, but I can't imagine it. I can't imagine retirement. Why? Like when I see people that retire, if they quit doing something meaningful, they're gone, man. They got 5 years, they're dead.
Well, the whole concept of retirement is a little bit skewed because, like you said, you might retire from one field, but you can't retire from life.
No,
it's just it doesn't work this way. And at the moment you do it, you're not alive anymore.
Exactly. That's right. You got to have a reason, a purpose for being here in this world.
Yeah.
And that's what, especially as Americans, we don't get it. Like in Europe, you go throughout Europe and you see how they do. They take a lot of time off. They spend time with family. They're out there eating dinner with family and friends, and just they are living.
Yes.
We tend to be working, right?
Yes. I was just there a couple of weeks ago. I'm Romanian originally, and I love to go back in Europe. And every time I do, I get a glimpse of that kind of lifestyle. And I'm looking at people. They're way up in age, and they're functional, and they're happy with their families and their peers, and they have a purpose, and that's what it's all about. But the problem is here in America is that financially, people cannot afford sometimes to retire, because the moment they do, they're strapped financially. So I'm trying to figure out, is there any way we can give them advice of how should they plan for that?
Plan for retirement?
Yeah, like strategies of getting maybe some passive income, or investments, or anything. Do you have anything in mind that you personally do or you think about?
No, actually, I don't. I really don't. I can tell you a story though about a friend of mine that's very interesting. If you want to hear it, he was a pharmacist, and he had it was a little pharmacy in a small town. He did okay, but he loved to hunt. That was his thing. He loved to go hunting. So he would go hunting, and he would, get like a deer, or if it was a goat or whatever it was, or wherever it was he was hunting, he would get it mounted, right? The animal mounted, and put it on his wall in his pharmacy. And this went on for years. And people would just come in, they'd see the animals up there, and be like, wow, that's amazing. Where'd you shoot that? He didn't tell him I was over in this country, that country. And one day, he said a dentist asked him, hey, would you take me with you? What would you charge me to go with you? That was the first time he ever thought of doing this for a living. And it wasn't but another 2 years, he was taking people hunting, $30,000, $50,000 a person, to go hunting for a week with him. And then he made millions as a hunter. Now that was an idea of doing something he loved to do.
Yeah.
And it turned into something prosperous for him. And that is, for me, I'm doing it right now. This is what I love to do. And people are right. In medicine, you're not going to get wealthy, unless you're going to jail. You're just not going to do it. And it can't be about that anymore, not in medicine. But I do understand how they're getting burned out, especially these family docs. Good Lord, I don't know how they can stand what they have to do. It's just working constantly all the time, and the pay is not very good. And God, you don't even want to ask them what they get per hour. They don't even want to talk about that because it's bad. It's really bad, And I don't know what to tell them. For me, it's been private practice. I don't take insurance. I quit taking insurance about 12 years ago because of the abuse. I couldn't take it anymore. I was done with that. And so we've just been cash-based practice. We're more of a concierge type practice. We don't see a lot of patients because we spend a lot of time with each patient. So that's how I've done it. And it's been really good for me and my wife. We're growing every year. It's getting, it's really good. It's really good. And that's the way we prefer to do it. We just, I got a letter from, of all people in the news, they're in the news, United Healthcare, about 13 years ago. They sent me a letter and they said, if you keep doing these tests that you're doing, we're going to cut your pay. That's the insurance environment for doctors. So, and And I'm like, nope, we're done with that. We are done with that. And then Blue Cross, they cut me too. They said, we had to get, for MRIs and CT scans, you have to get these pre-approval things, right? You got to call up and talk to a nurse and say, here's the problem. I need an MRI. It's the dumbest thing on the planet. I don't know why they think we wouldn't know. We're not getting kickbacks or anything. We just need an MRI, right? So I get on with this girl. I don't know if she's a nurse or what, but I'm like, look, we got a patient. She's a cancer survivor. We see a lesion on her lung. She came in with a cough. We need a CT scan. She comes back. Oh, we don't do CT scans for that. I go, really? I go, what is your name? It's Liz or something. I go, okay, I'll let the patient know, Liz, that you have assumed her care and you're going to take care of it going forward. So we're good. I'll let you go. Oh, no. She goes, wait. She goes and gets a supervisor. Supervisor comes back, says, here's your approval number, but you tell that patient this is not guaranteed payment. And that was when I really made my mind up. I was done with it. I know patients need to use insurance. My goodness, we all do, right? I get that. But that abuse, I just couldn't do it anymore. I couldn't take it anymore.
Yeah, this is a whole other discussion about insurance payments in the medical world. But I agree with you. I think
doctors have to find out what their love is, right? What do you?
Yeah, no, absolutely. And even the fact that you could have the choice of not taking insurance, that's a success. Because most people don't have that option.
No.
So yeah, it's great. So Dr. Brown, you've been through a lot, right? Education, patient care, private practice.
Mm-hmm.
With what you know right now, and your experience, if you would look back to yourself from the beginning, what kind of advice would you give?
Become a software engineer first. Because that was back in the 80s, right? That's what I tell if I could go back in time, I would tell myself, become a software engineer, work for about 10 years, then go to medical school. Right?
I see. Yeah.
And then I would have that technology background and be able to develop a lot of new things for medicine.
Yeah. Well, that's apparently what the whole thing is going to right now.
That's right.
And especially in brain treatments, you have to be someone who is kind of technologically advanced to treat those things.
Mm-hmm.
Well, so what projects do you have right now? What's exciting you for the next year? What are you looking forward to?
Well, right now, as crazy it might sound with my restlessness, right now I'm just focusing on my patients. That's what I'm doing. I said I've got to stop running around. I've got to just settle. I need to just settle my mind down. So that's what I'm doing. That's what I'm really trying to focus on, is just being more mindful of my thoughts and not let them chase around, everything that comes up. That's what I'm doing. Just becoming more at peace,
Yeah. So if someone wants to learn more about this new dementia treatments, for example, or anything that it relates to it, how can they get in touch with you?
They can just go to my website. It's at mindperformancecenter.com. And on that website, there's all kinds of information. And there is a class they can take about dementia. And it's free, by the way.
Very nice. Very nice. I actually encourage everyone to look into these things, because you never know when it hits. And it might be too late for you or for the family members. If everyone can relate to this kind of issues with parents or grandparents or people in the family. So I think it's important to have that option. Well, thank you so much. And I hope we can circle back at some point to see where this thing is going.
Yeah, absolutely. Thank you so much for having me. I've really enjoyed it.
Absolutely. Thank you.
That's a wrap on Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.